ask you point blank, because this has come up time and again. When men are not in good health, does that affect their sexual performance?
100%.
Oh my goodness. Oh, you got it loud and clear. Thank you.
That's health of mind and body.
All right. Now, it's interesting that Quincy here gave me two categories of sexual performance concerns, right? And yeah, you're holding something there. Show the book. Can you show it on cam? Go.
This
Show
is one full book about premature ejaculation.
PE. It's not the PE in school, no?
Not physical education.
No, okay.
And one book about andropause and erectile dysfunction. Andropause meaning aging in men.
It's like the menopause for men.
Yes, menopause is to women while andropause is to men. And you cannot deny it, but they do deny it. That hindi sila nagme-menopause.
You know, I said women, when we get I can actually say I don't have menopause because I'm senior. I'm done with menopause. So I don't have it. I have a diploma, okay? But men, I say like, they get better, they peak, and when they start to wane, can they please just admit it's some sort of male menopause, andropause, or call it what you want, but it's just not, it's like a car again. It's just not performing the way it used to.
Yes. The funny thing is, if you're not healthy, you have sexual dysfunction. If you have sexual dysfunction, it means that you are unhealthy.
Again, it's like a car. If it's not performing well, then the spark plugs are misfiring.
Exactly.
You have to change oil, right?
Vicious cycle siya.
But you see, the nice thing is in a car, you can do tune up, which is preventive, no? Or sige, I like
Yun
it.
nga eh.
Oh, wait. I know what you're gonna say. You can do tune up, you can do engine overhaul, can be, diba? Heart, blah. But you see, when it's really bad with the car, you can change the engine. Now, what do you do with the malfunctioning guy?
Well, when it malfunctions, especially the heart in comparison to the engine, wala na, bypass na yon.
Okay, you're talking about the heart, but you mentioned erectile dysfunction and premature ejaculation. Now, many people joke about that. Can you please identify what is erectile dysfunction about and what is premature ejaculation about? People confuse. Like grammatically, you should know. Please quickly say it in non-jargonic terms, direct to the little blue light there.
Yes, I will try my best.
Teach the millennials so they know, huh?
Erectile dysfunction is when you have difficulty getting the penis erect.
In other words, it is physically present but performance-wise absent.
The mind is willing but the body is weak.
Yes. It's like showing up in elementary school for oral exams and not being able to give the answer.
Yes, that is erectile dysfunction. The difference between erectile dysfunction or ED and premature ejaculation or PE is that when you try to perform, you do perform, but you ejaculate in 4 minutes or less of sexual activity. Very short yon.
Wait. So you're saying that the PE, the premature ejaculation, maybe can be called in a hurry, or was in a hurry, or finished the test before the bell rang?
Yes, but not necessarily in a hurry. Wala, they cannot control it. It's coming, it's ejaculating. And it's usually performance anxiety or any form of stress or anxiety. So it's mainly from the head, from the mind.
Maybe if they're cheating, they're afraid to get caught.
That's one too. But it's really performance anxiety and some forms of stress.
Question.
Yes.
Because I know this is millennials. Listen to this. When people are young and they like to do the no-nos, and when they're married, they're cheating. But when they're young, it's like they don't book a room. They kind of hide here. I'm talking about the really young, like in the movies, in the haystack, in the barn, in the barrio behind the tree. I don't know, under the bike. So they're just here, there, and everywhere. So what I'm trying to say is, someone told me that the programming of the first sexual experience programs like education, like a car, how do you call braking in a car? It has to be broken in properly so that the engine will be performing at peak performance, right? So this, how do I say this without getting in trouble on air, right? So um, I heard some stories that when a boy and a girl, see, not a man and a woman, a boy and a girl are very young and they want to engage in sex, and they know they're not supposed to do it because they're not supposed to. They're not even 18, right? So they just want to do it and get it over with.
Yes.
So is it true that's why they're programmed to be fast?
I think there's still part of anxiety because
Ah,
bawal
so
and kulang ako ng time. It's always more often than not anxiety when it comes to premature ejaculation.
So the anxiety is still a nervous tension.
Exactly.
And then it just stays that way because they never learn it. Because, you know, it takes 21 repeats to become a habit.
Okay.
But that's terrible. So they're habitually physical education PE.
Exactly. Which
No.
is not a very good experience for the woman, I suppose.
Correct me if I'm wrong. That's why so many women tell me, I don't like sex. And I'm like, why don't you like sex? And they're like, it's no fun. I used to think there was something wrong with the women until I finally figured out, women, you go to that the reason the women don't like sex is the guys are just such bad performers. Quincy, please.
I will not
away
speak
from
as
here.
a professional.
Okay, speaking as a female, yes. Okay, so can they go to you and ask how to get things better? Maybe you have I don't know, some tips for them. Give them your number, please, so they can talk. Please, for those of you who have performance anxiety, women have the right to have pleasure as well. Okay, so the number is.
I totally agree. But before the number, we have the website of the society, which is a group of doctors who can help you with your men's health issues. That's menshealthph.org. Again, menshealthph.org. It's getting hot in here.
Yeah, I know. Sex is always an interesting topic with wellness. If you're not performing well, one is it's performance anxiety, but again, maybe your body is not performing well. Now, she said sexual performance, meaning the curtains go down. Okay, show. What? Show. Yeah.
Premature ejaculation is 4 minutes or less, but our films are
So the film, make it grade
10
one.
minutes
Okay.
or less.
Okay, again, for the film,
For the film, 10 minutes
okay,
or less.
for the sexual performance,
Should not be 4 minutes or less.
okay, so it should be more, but never less. Okay? Can we bring, I think I should produce or get more pots, okay? So if any guy finishes the performance below 4 minutes, the woman should honk so all the neighbors know. I thought I was bad. This one's really bad.
I think I have a horn at home.
Yes. Okay, let's not go down that joke about horns. So I have a joke for Dr. Quincy Raya. When she's good, she's really good. But when she's bad, look, she's even better. All right, so don't go away, Dr. Quincy Raya. I tell you, sexy, brilliant, beauty and brains. She is a doctor of choice, and I'm not a man, but yes, she handles women as well, but specializes in men. Yes.
Yes, I do.
So Dr. Quincy Raya, when people ask you what's your specialty, she will say men.
Yes, that's true. Preventive medicine and men.
Okay, there you go.